Becky's gonna take it from here. One quick thing, if you're not familiar with Zoom, there's controls along the bottom and along the top. If you need to ask a question or if you're having a technical difficulty or anything like that, feel free to use the chat button on the bottom. And then you can direct that directly to me. And if Carmen gets on board, I'll also have her be co-host. So you can direct those technical questions to either Carmen or myself. The questions for tonight's Otter Talk were pre-submitted prior to tonight's meeting, and those are going to be, I think, incorporated into the presentation. So I don't think that we're going to have time for questions from the participants. If we do, or if you have a question that you really is burning a hole in your brain, feel free to put it on there, and maybe they can answer it by email later on, or we can include it, the information on the YouTube description. So with all that being said, I'm going to turn it over to Becky. Becky, it's all yours.
Thank you. Thank you. I'm really happy that we're able to gather together and learn more about the use of CBD in treating seizures. As we know, seizures in Otterhounds are all too common. And as owners, many of us have individually searched for solutions to the condition affecting our beloved dog. We recently heard from Dr. Karen Muana at North Carolina State discussing her research on gut dysbiosis and a possible relationship to seizures in dogs. Tonight, the Otterhound Club of America is so pleased to bring you information about research ongoing at Colorado State University on CBD treatment for idiopathic epilepsy in canine patients. So first, I'd like to introduce you to Dr. Brittany MacQuiddy. Dr. MacQuiddy graduated with her veterinary degree in 2017. She attended veterinary school at St. George University for the first 3 years and completed her 4th clinical year at Washington State University. After graduation, Dr. MacQuiddy completed a 1-year small animal rotating internship, followed by a 1-year neurology specialty internship at a private practice in Connecticut. She then returned home to California for 1 year to work in emergency medicine. Dr. MacQuiddy is currently the neurology clinical trials intern at CSU and will be staying on to start her neurology residency training next year. She has a particular interest in seizure disorders and spinal cord disease. After completing her neurology residency, Dr. MacQuiddy will work in private practice, but hopes to eventually return to academia. Additionally, we have Brianna Cusick. Brianna's been the person that I've been communicating with about getting this all set up. Brianna has a bachelor's in biology, and then she worked as a vet assistant technician for 7 years while obtaining graduate degrees. She has a master's in healthcare administration and a master's in biomedical sciences, concentrating in neuroscience. Shortly after that, she started her role as clinical trials coordinator for Dr. McGrath's CBD for epilepsy study, and she has since helped merge all the studies into the neurology department into one clinical trials department. As she finished her training to become a certified veterinary cannabis counselor back in September, she's hoping to use her broad experience to help progress the research and help patients who don't qualify for the studies ongoing. So thank you and welcome to both of you. We're so happy to interact with you tonight. Thank you.
Thank you, and thank you for inviting us. We're so honored to be here and to share our research with you. So like I said in the beginning, I started in July, so I'm kind of jumping into the ongoing research. And so I wasn't part of the initial research they did, the pilot study, but I'll touch on those things. And you heard that Brianna took some courses to be a certified counselor for CBD. And so she is, I say she's an expert, she doesn't, but she definitely knows more than I do. And so there might be questions later on that she might be better suited to answer, as I'm still learning about CBD and its uses. Right now, my exposure is limited to CBD use with epilepsy, but even then, our current study is technically blinded. So we don't know what dogs are receiving, either the CBD or the placebo, but we'll get into that in a bit. So I did come up with a PowerPoint. It's very simplistic, but I'll elaborate on some things. And then I did have the questions at the end that I can answer, but certainly if you guys come up with anything else, again, email us, or if we have time, we can answer some of those here as well. So I'm gonna share my screen. PowerPoint, window. Oh goodness. I don't think it wants to do it. It wants me to go into privacy, Zoom. Wait. So sorry for the delay. I don't think it's gonna let me do it. Do you know how to do this? Not from a Mac. That's okay. All right, never mind. Like I said, the PowerPoint is very simplistic, so I'll just kind of have it open in front of me. All right, so we're gonna talk about CBD use for epilepsy in canines, but I'm gonna kind of do a brief overview of, why we're interested in cannabis in the first place, the internal body system that, we produce endogenous cannabinoids within our body, and most vertebrates and invertebrates do that we found. I'm going to talk about exogenous cannabinoids, the CBD mainly, and then get into the details of CBD, the potential medical uses in veterinary medicine, side effects that we can see, and some contraindications. And then I'm going to get into the research that we've done and that we are doing. So I don't know if you guys are aware, but there's something called an endocannabinoid system within the body that, like I said, is found in nearly all animals. It is involved in both communication within cells and between cells. It's found to have a role within most systems within the body. So the cardiovascular system, the neural system, it's in immune modulatory system as well, and it helps to maintain kind of homeostasis between systems. It consists of cannabinoid receptors. So there's two different receptors that we talk about, and I'm not going to go into great detail because it gets all very confusing. But there's a CB1 receptor, which is mainly in the nervous system. And then there's a CB2 receptor, which is mainly in the peripheral tissues or in the immune system. But these receptors are all over the body, and it's not strictly just in those areas. And then we've got the cannabinoids, so that's the actual molecule that our body produces. And interestingly, they have described that your body can be deficient in cannabinoids. And then finally, there are the enzymes that help to kind of regulate the cannabinoids. So they're responsible for activating and destroying the cannabinoids. So then we go on to exogenous cannabinoids. So these are what's made outside the body, the external molecule. They're broken up into phytocannabinoids, which are the plant-based cannabinoids, and then synthetic cannabinoids. And we're just going to be talking about the phytocannabinoids. So the cannabis plant contains over 180 cannabinoids in all. And the two main ones that we know of, or that are most common, are CBD and THC. There are other cannabinoids that are, coming up in research, but these are the ones that you guys have probably heard of. In addition, the plants also contain what are called terpenes, which are responsible for the aroma or the smell of the plant. And then the flavonoids are responsible for the flavor. So the terpenes, I guess, have other, potential benefits, or there's more research going into them, but we don't really know as much. But the flavonoids, it sounds like there isn't much research going on with them or any other potential benefit that we know of now. So cannabis, the plant, there are a few different species. When we talk about CBD, we're talking about cannabis sativa, but there's also cannabis indica and cannabis ruderalis. As part of the variants of cannabis plant itself, there are hemp plants and marijuana plants. And the differences are just basically that they're cultivated at different time points, as well as the main one that we care about is that hemp plants contain less than 0.3% of THC, whereas marijuana contains greater than 0.3% THC. And why that's important is because, as you guys probably know, THC is toxic to dogs, and greater exposure to that can lead to unwanted side effects, and they haven't really derived a use for THC in dogs yet, but I believe research is still coming. But at this point, CBD is consisted of less than 0.3% THC. When we talk about the different products that are available, they come in wide ranges. So there's oil, which is what we've been using in our studies. They come in capsules, they come in powders and skin lotions and all different ranges of things, treats as well. But we are just using the oils. They also talk about full spectrum versus single isolate. So basically, full spectrum involves not only CBD, but other components of the cannabis plant. When we talk about a single isolate regarding CBD, it's mainly CBD. So CBD is the non-psychoactive part of the cannabis sativa plant. It has activity at multiple receptors within the body and is involved with multiple systems. It has multiple interactions with different pharmaceuticals because of the receptors that it can interact with. The main one you guys would be interested in or know of is phenobarbital. They are both metabolized through the liver, and there's a specific cytochrome P450 receptor or enzyme that they are interact with. And so they kind of have this competitive affinity for these receptors. And so what we can see is increased levels of phenobarbital within the system when there's use of CBD. Now, they've mentioned other interactions like with sedatives or anti-inflammatories, analgesics, other pain medications. So there's definitely a lot of different described interactions between other pharmaceuticals. However, this has all been really in like clinical studies or in trials, just in research. But it sounds like for the most part, in a clinical setting, it doesn't seem to be too apparent, but that is just something to take note of and something we could potentially see. Now, when we think of CBD, a lot of people think it's a natural product, so it must be really safe. But CBD does have its own side effects. So natural description doesn't necessarily mean it's a safe product. And it's every individual animal is going to respond to CBD differently. So it's hard to say if it's going to be exactly safe. The goal is to, we'll talk about this later, about dose finding as finding the perfect dose to put your dog on. We usually say to start at the lower end at a really low dose and work your way up if you're not seeing desired effects, just to make sure that they don't have any adverse reactions. So the potential medical uses that we, have been reported in animals, definitely for, relieving pain. They are immunomodulatory and anti-inflammatory, so they can help with inflammation. They obviously we're using it hopefully as an anticonvulsant. They've used it as treatment of glaucoma. They talk about anti-cancerous processes that CBD could have, using it for anxiety, blood sugar regulation in diabetics, GI support, and neuroprotection. These are just a few potential medical uses in animals that stem from what's been found in humans. And humans have a lot longer list about what's been researched and what the uses, what they're using it for. These are just a few side effects that we can see, but, oh, you guys can't see my PowerPoint, but I'm gonna go through them. So we can see ataxia or a wobbly gait. They can seem a bit drunken. They can be very sedate on this medication. They can get GI upset, so they can have a decreased appetite, diarrhea, vomiting, things like that. And they can also, interestingly, we can see foraging behaviors. So getting into the garbage and seeking out eating foreign material. So that's an important one that potentially could lead to a very expensive surgery. So definitely want to monitor for those side effects. Contraindications of CBD have been described, although not extensively researched, but they say to be cautious in patients with moderate to severe cardiovascular disease, because it can cause arrhythmias. It can cause either acutely a tachycardia, so an increased heart rate, or chronically it can cause a bradycardia, so a slower heart rate. It can also exacerbate underlying arrhythmias and cause changes in blood pressure. They say with really high doses of THC, it can cause a low blood pressure, but when you give high doses of CBD, it can cause a high blood pressure. So I guess that's the important part about starting at a lower dose, even in otherwise healthy animals, because it can alter the blood pressure. Also, they talk about caution in patients if you guys decide to breed your animals and your animal is pregnant or breastfeeding. They recommend caution in patients that are pregnant, as well as, I said breastfeeding because it can be transmitted through the milk. And they say there's a difference between the lapse of CBD in the milk versus THC. I guess THC remains there a lot longer, but those we don't have, definitive numbers. There's also, because it can have an effect on the liver and is broken down in the liver, any animal with an underlying liver disease, we'd probably recommend caution. So moving on to the research, I'm going to talk about the pilot study, which I wasn't present for, so but I have some results and preliminary details, or the details. So the title of the paper was Randomized Blinded Controlled Clinical Trial to assess the effect of oral cannabidiol, so CBD administration, in addition to conventional anti-epileptic treatment on seizure frequency in dogs with intractable idiopathic epilepsy. So this was done in 2018. The purpose of the study was to evaluate whether the addition of CBD in the treatment protocol for idiopathic epilepsy reduced seizure frequency compared to the placebo. The enrolled dogs were randomized, so they were put into either a CBD group or a placebo-controlled group, and the observers were blinded to which group the animal was in. The dogs were either administered 2.5 milligrams per kilogram twice daily of a 100 milligram per ml CBD oil, or an equivalent amount of placebo oil for a 12-week period. 26 client-owned dogs with confirmed idiopathic epilepsy. So they had to have an MRI and spinal tap and rule out other causes of seizures outside the brain to be enrolled. They had to also have at least 2 seizures per month for 16 weeks before entering the trial. So 26 dogs were enrolled. Unfortunately, only 16 of those 26 completed the study and were included in data analysis. 9 were in the CBD group and 7 in the placebo. The reasons for the other 10 not being included were things like their seizures began to get out of control, and so we need to adjust medications. Owners weren't able to comply with visits and come back for rechecks. Some dogs, 2 dogs of the 10 showed general proprioceptive ataxia, so they were just looked generally drunk and had a wobbly gait, and so they discontinued their oil. 1 dog was euthanized, unfortunately, due to status epilepticus, a seizure lasting longer than 5 minutes that doesn't respond to intervention. And then lastly, a dog was not included in data analysis because the owners were, in addition to the trial oil, which we didn't know at the time if they were receiving CBD or the placebo, but in addition to that, they also took it upon themselves to administer CBD. And so it ended up that they were in the placebo group, but administering the other oil kind of disqualified them from the study. So for the remaining dogs, they recorded CBD plasma concentrations, blood work, so a complete blood cell count and chemistry evaluating liver, kidney values, things like that, at time 0, 4 weeks, 8 weeks, and 12 weeks. They recorded all seizures, and they also sent out a behavior survey each week to kind of monitor the dog's behaviors and see if there was any changes noted at home. So for the results, 2 of the dogs in the CBD group and 2 in the placebo group were considered responders, which was classified or defined as having greater than 50% reduction of seizures. However, this wasn't a significant difference between the 2 groups. But overall, when we looked at the seizure frequency among both groups, there was a significant reduction of seizures in the treatment group compared to the placebo group. Just it was less than 50%. Other findings, a big one was also that with increasing plasma CBD concentrations, they correlated the decrease in seizure frequency. So the more CBD that was in the blood correlated with a lower seizure frequency. So that's a interesting finding. There was also a significant increase in serum ALP, which is alkaline phosphatase. It's a liver enzyme. And so they noted that it was significantly increased in the treatment group versus the placebo group. Interestingly, throughout the pilot study, they did not note any change in behavior or adverse behavioral effects with treatment of CBD. So the trial that we're currently doing is still ongoing. We have closed enrollment. We enrolled 61 dogs total. It's a double-blinded study, so we don't know and the owners don't know what they're giving their animal, and it's placebo-controlled. So, and it's also a crossover. So that means that they start off with one oil, and then 3 months later, after a washout period of 1 week, so not receiving any oil, they start the second oil for another 3 months. So each dog in the study has at some point received or will at some point receive the CBD and placebo. We don't know any results yet. We should have results early next year. The study will be completed in March after the last dog has, completed the study, and it's a total of 7 months in duration. And we currently still have 6 dogs ongoing in the trial. So I wish I could give you guys more, but we really just don't have results yet. but stay tuned. And then kind of towards the end of this study, the next study will be what's called a dose finding study. So we kind of hope to evaluate and enroll dogs with confirmed idiopathic epilepsy into 3 different groups. And those 3 different groups are going to be based on the dose that we give of CBD. So there will be no placebo. It's strictly to find, the doses that are most, effective, hopefully. So the 3 different groups, the first will receive 5 milligrams per kilogram, then 10 milligrams per kilogram, and then the third group will be 20 milligrams per kilogram. So it'll be interesting to see kind of if there's like a ceiling effect of CBD, or like we found in the pilot study, it looked like with increasing concentrations within the blood, that there was kind of a correlation between a decreased seizure frequency. So hopefully that study will kind of work through those questions. I feel like I went through that kind of fast. That was kind of the end of my presentation. I'm sure that there are things that I maybe forgot or just didn't mention, because like I said, my PowerPoint was pretty simplistic. But I do have the questions that you guys had sent us earlier, so I'll go through those, and then it looks like we will have time for other questions if there are any. So I kind of just reworded some of these just to condense it. So someone had asked about their dog that was on phenobarbital for seizures, and CBD was started, and it looked like it was having an effect. And they asked if CBD could ever be used alone and phenobarbital could be discontinued. At this time, CBD is not used as a primary or anticonvulsant that's used alone. I wouldn't recommend it clinically unless your dog is a dog that has a seizure once every 6 to 12 months or something, very infrequently. Then maybe CBD alone would be helpful. But even then, it's almost like we usually, so if your dog came to me and it was having a seizure every 6 to 12 months, very infrequently, we don't even usually start dogs on medications at that time. So I would say it couldn't hurt to start your dog on CBD if the seizures were that infrequent. But when we have seizures that are, the dog was on phenobarbital and still, maybe not showing a good response, but showing response to CBD, I would be a bit hesitant to stop the phenobarbital altogether. I think it's fair to say that we can potentially decrease the dose, but I wouldn't stop it altogether. The next question was, how equal are CBD products from a variety of sources? So it's true that you can basically find CBD products anywhere. They are over the counter and don't require a prescription. So it's hard to say, which is from your perspective, it would be hard to say, what is the best CBD to use. For us, because they're not a regulated, it's not considered a drug. It's not considered like a supplement, or it doesn't have a specific classification yet. And so there are no standards with things like that in veterinary medicine. They don't really have standards for people to quantify, what's in your product for how you label it in the store. But if you, want to know, yes, this is exactly based on the ingredient list, this is exactly what's in there, we recommend looking for what's called a certificate of analysis. And so that'll tell you exactly and how much of what's in that product, as well as if it's pesticide free, if it's free of any heavy metals or, other infectious agents like fungus or bacteria, things like that. So if they have a recent certificate of analysis, that is very important to look for, to know that it's a, certified product, and what is in that product is actually in there. Because there are some products that might claim either more or less CBD within their product than is actually in there. So it can be hard to know even how much of that product to give if they don't have a certificate of analysis. Next question, how long do you think it will be before CBD is widely recommended in veterinary medicine? I would say probably not until it actually gets a classification, because at this point, it's kind of a gray area whether or not veterinarians can recommend it. I just learned today that in California, they passed a law that said that veterinarians can talk about CBD, but it's still not said whether or not they can prescribe it. Or say, yes, you should go on it. So there's a lot of legal issues surrounding CBD, which is why most people don't talk about it. And like I said before, now I never recommended it to anyone or talked about it even. So I think it'll be a while, at least until more research comes out about it. And hopefully the research that we're doing here can help with that. That would be great. But the timeline is hard to predict. The next question was, what advice do you have about a dog that has just started having seizures? Fortunately, the only thing I can recommend is that you have your dog seen. Seizures can be caused by many different things. They can be caused by things both inside and outside the brain. They can be caused by toxin ingestion. So anything containing xylitol, which is a commonly used in sugar-free gum, can cause a decrease in blood sugar and lead to seizure activity, which once you, and xylitol ingestion can unfortunately be fatal. So there are other liver diseases as well that can cause seizures. Really overdoses of insulin, if your dog is diabetic, can cause seizures, because again, there's that drop in blood sugar. So it's nice to be able to, it would be nice to see your dog, evaluate, do an exam. Are they normal between seizures? Are there other behaviors that are being seen? There are a lot of factors that go into deciding, where we think the source of the seizures are coming from, because ultimately a seizure is not a disease. It's a clinical symptom of something causing that seizure. So there are other things inside the brain as well, other than just idiopathic epilepsy, that can cause it. So I would definitely recommend having your dog seen if they start having seizures. The next question is, what other studies are going on, and why did we get into researching CBD oil? As far as I know, there may be a couple others. There's a study going on at the University of Florida, and they're doing a pilot study looking at the use of CBD during chemotherapy for dogs that have lymphoma, so a form of cancer. I don't know any details about that, but that's going on. And then other than dogs, there is a study going on in horses in Texas, looking at a CBD use for anxiety and arthritis. Why did we get into researching it? Well, a lot of this stems from what's happening in human medicine. They've done a lot of research already with the use of CBD and its effects on the human body. So I think a lot of it stems from that, and we started getting questions. Everybody was asking, what about CBD for dogs, if we can use it in humans? So that's why we started getting into this research, and I really hope it's fruitful and helps. The next question was how to figure out what dose to give. So if you find a product that you think is a good product, has the certificate of analysis, a lot of those products have a dose labeled on the product itself. But what we usually say is to start at a very low dose and work your way up if you're not seeing desired effects. So if your dog, it kind of depends on what you're using it for, but I would at least give it, a couple weeks time to see any sort of changes. So if you're using it for anxiety, then I would give it a couple weeks. But if you're using it for seizures and your dog is having seizures, once a week or once every few weeks, then I would give it until that next seizure episode. And if you need to, you can go up in that dose. But in general, what we tell people is start out at 0.25 milligrams per pound up to 0.5 milligrams per pound. But the high end of the normal dosing range that we have seen, or that we're even using in this study currently, is 4.5 mg per kg, which is about a 2 mg per pound. But definitely, if you're not comfortable doing those adjustments, talking with somebody about it. Hey, Brianna's here too. She is now able to talk with you guys about it. So if you need help with anything, you can definitely reach out. The next question was, can dogs build a tolerance to CBD? Unfortunately, that's something that we don't know right now. There hasn't really been any research into it. It's definitely possible, but I can't really comment on it just because we don't know anymore yet. But hopefully future studies will help with that. And then the last question I had, or kind of a two-part question, can you use CBD for anxiety-inducing events, and when do you give it? So they definitely have used CBD for anxiety in dogs. I think it's more anxiety in general. So I don't think we particularly know about like thunderstorms or a car ride or going to the vet or anything like that. But if you're going to use it for that particular purpose, I'd probably give it starting 24 hours before the event. So giving a couple doses. We usually recommend giving CBD twice daily, but you can always start at once daily if you'd like. But definitely starting a little bit further back, so 24 hours in advance, just to give it time to kind of build up in the system if you're just going to give it, a couple times and it hasn't been given consistently previously. If you're giving it consistently already, then just give it, 2 to 3 hours before the event. The reason for the 2 to 3 hours is that we've seen in previous studies that the maximal level of concentration within the blood is at that point, 2 to 3 hours. So I hope I answered all those questions completely for you guys. If there were any follow-ups or additional questions, I'd be happy to answer them. And Brianna is here too, so she can help with that.
So I'm going to interrupt. This is Robin. I'm going to go ahead and open the chat function to anybody that has questions that they want to put in chat, or if they want to unmute and ask questions. I do have a couple questions. What strength CBD oil was used in the study, or what strength do you recommend?
We have been using 40 on this current one.
Our current study, the concentration is 100 milligrams per milliliter. It's pretty rare to find concentrations that high that are sold. And so in terms of strength, it's really going to depend on your dog's size. I know you guys with Otterhounds obviously have larger dogs. So in general, for larger dogs, I think it's a really good idea to look for those higher concentrations. So finding something between, 70 to 100 milligrams per milliliter. The tricky thing is that that's not how bottles are advertised. So as I'm sure you know, bottles are advertised. It'll just say something like 300 milligrams, 600 milligrams. And so then you have to do a little bit of math, and you have to see how many milliliters are in there. And then of course you just divide that. It's luckily not too bad. But you'll be surprised sometimes when it looks like there's a lot of CBD in a product, and it turns out it's actually a very low concentration. So it's very important to look at that concentration in the bottles.
How long does CBD stay in a dog's system?
No, it really actually gets excreted pretty quickly. I think from our previous PK studies, within a week, we found that it was mostly out of the system. For our study, we give dogs an entire four weeks for it to be fully washed out. But yeah, easily within a week, it should be out of the system.
How long is the effective dose in their system for? Like how long does
so
the dose
how long,
last?
my husband just asked a question, how long is the effective dose in their system? So I've always thought it was like about 8 hours. Like if you need to keep them on a regulated amount, that every 8 hours would be about the amount of time. Is that?
For CBD, we say 12 hours based on our pharmacokinetics. So you want to, that's why we'll normally recommend giving it twice a day. So every 12 hours.
Great, thank you. Any other questions from the field? Feel free to use your chat button or go ahead and ask Brittany.
I've got a question. Now that you're down to 6 dogs in your study, do you really think that you're going to be able to come up with some conclusions that would be spreadable through the entire breed, or do you have plans to use this study and catapult it into additional studies? And if so, which direction will you go?
Yeah, so so for those that have finished maybe I misspoke earlier. So we had enrolled 61 dogs. They all start at different time points. So they all start and finish the trial at different times. So there have been 55. There have been 55 dogs that have already completed the trial. So we have all of that data to work with. And then once the rest of them, the 6 remaining, finish in, the last one will finish in March of next year, 2021. And once we're done with that, then we can start to unblind ourselves and look at the results. But it's not that we just have 6 dogs in the study. We have all of the other dogs too. So it's going to be a total of 61 dogs that we'll have data from. And then,
oh, I'm sorry, go ahead.
Oh, sorry. Like you said, after this study, the next study is the dose finding study. So what we've done now is we've taken CBD and a placebo and compared it in all these dogs, because they've all at one point or another been exposed to the placebo and CBD. So we're able to compare a placebo to CBD. Now the goal for this upcoming study will be to find the most effective dose. And so also we want to sort of establish a safety range on that dose. Right now, the safety margin is pretty wide, but we want to know, is there a ceiling effect to the dose? Like, is there a maximal dose that you can give and you'll see the maximal effect, and after that, there's no more effect? So things like that, we hope to find with the new study.
Nancy Lang, do you have a question?
I sure do. I have an Otterhound currently that's on numerous epileptic drugs. And when she comes out of post-ictal state, she is obviously very, very anxious, paces, tries to stick her head into dark spaces and so forth. Could CBD be used as an urgent drug to decrease these kinds of symptoms or help her in that post-ictal state? And if so, would the dose be the same?
That's tricky. I mean, it's challenging because from the research perspective, we haven't seen that it has kind of some of those instantaneous effects. It seems like it does need to be kind of loaded. However, I think a lot of people have seen the YouTube videos, you know, of people when their dogs are having seizures and they drop a little bit. We think for the most part, it's probably a little bit coincidental of, you know, just kind of introducing a stimulus to the dog, and that's what's causing them to stop that session. So what I would say is that I'm not sure it would be effective. However, I also don't think it would hurt to try. In terms of a dose, if you're doing a single dose, I think you're safer to do a higher dose if you want to. But again, I think it's always smart to start with a low dose and just see what happens. If nothing happens, try a higher dose. If nothing happens, you can try a little higher. Really up to, right now, I would say up to that 2 milligrams per pound. You could potentially go a little bit higher for a single dose, but I wouldn't push it too much right now until kind of some more research comes out with that safety. So it's hard because we haven't, there really hasn't been a lot of research done, to my knowledge, of post-ictal behavior in general, and anything that can really help with post-ictal, which I know is sometimes more challenging than the seizure itself.
That's true.
Yeah. So I know that wasn't a great answer. That's kind of the unfortunate part about CBD. There's a lot of excitement to it because there's a lot to learn, but unfortunately there's also a lot we don't know yet.
Thank you.
You're welcome.
Oh, wait, Gregory, do you have a question?
I do. I'm sorry. I was late. I got caught up at work. So if you address this, I apologize. But I was at the national, the AKC Canine Health Foundation National Parent Club Conference last time, and somebody was speaking on it. I'm sorry, I don't remember who it was. And they said that one of the things that you guys found was that it seemed that the effective doses all cause diarrhea. Have you found that you can get effective doses without diarrhea now, or do you just ramp up more slowly? How are you addressing that?
So I don't know what a study they were referring to. To my knowledge, the pilot study didn't have any adverse effects. So none of the dogs showed any, side effects from it or adverse events. So I don't know of that particular study that you're speaking of. I don't know. Was that done here at CSU? Me and Brianna are unaware of that particular study that you're referencing.
Yeah, the researcher was from CSU, so I would think it was.
I do know in our pharmacokinetic study, the first one we did, most of the dogs did develop diarrhea kind of across the board. It was somewhat ruled out as a side effect because we saw it in all three of the groups, and it was most likely related to be a stress-induced event. Once we started the dogs on metronidazole, it cleared right up. But yeah, Dr. MacQuiddy's correct. Our pilot study, we did not see any diarrhea. And then luckily, again, we don't know when dogs are on CBD versus placebo, but I can say that I have not seen any diarrhea other than, clear dietary indiscretion when the dog got into the trash or something like that. So yeah, I think hopefully a good answer to your question is that we do not classically see diarrhea as a side effect, although it is still listed in humans. And so something to keep your eye on, but hopefully not a big concern.
Okay, thank you. And then if you don't mind a follow-up question, I understand the certificate for products, but do you have a product name that you would recommend, like Elevet or somebody, any of the products that you would say are going to have CBD and not THC or anything else that they shouldn't in them?
Yeah, so there's the two companies we've worked with, Applied Basic Science Corporation, and I can type this out for you guys, and then Extract Labs based out of Boulder. They're both great companies. Elevet's a good one as well. Gosh, I'm blanking on the name. There's another one, New Leaf. They're a really good company as well. So those are ones that I know. I personally looked at their certificate of analyses. I know that they're reputable. Obviously at CSU, we can't, recommend one company versus another. We don't want to play that game by any means, but those are 4 companies just off the top of my head that I've seen their certificate of analyses, and I know that they are reputable. But certainly, if you guys ever have any questions about a company, you can always send me an email. I'm really happy to look into it for you as well.
Thank you. I appreciate it.
Of course.
Ashka, did you have a question?
Yeah, my question is related more to heart diseases and the side effects of CBD on arrhythmia patients. Is there a study, or would you recommend a CBD for a dog with a heart disease arrhythmia specifically?
I could certainly, I don't know off the top of my head any specific research that was done in dogs with heart disease. They just know because it interacts with the cardiovascular system that dogs with heart disease can be affected. And like I said, it has, I can't reference the specific, I can look into it for you, but I can't reference the specific study, but they have seen, potentially changes, increases or decreases in heart rate, which could potentially affect a dog with structural heart disease. So like a faulty valve or something like that, or, enlarged chambers, things like that. So that could definitely affect a dog with heart disease. And then a dog with an arrhythmia, so an electrical abnormality,
Right.
It has been shown that it can cause some arrhythmias as well. And then it also can cause changes in blood pressure. So if you have a dog that's, hypertensive for one reason or another, it may be contraindicated. So unfortunately, they have stated a bunch of things about CBD. They've stated that it's contraindicated with cardiovascular disease. They stated it's contraindicated with liver disease. Basically, CBD, or the cannabinoid system that I talked about, is involved with every system almost within the body. And so it could be said that for any underlying disease, use caution, basically. So it's hard to say, and they've said clinically they haven't really seen too much, but when they do these studies, yes, they can see some side effects with these dogs with underlying heart disease. So I can certainly try to root around for you and look at a specific paper or research or trial that somebody has done, because I don't know off the top of my head. But all we can comment on now is that, they've had these preliminary findings, and so we have to exercise caution. So if you were going to use CBD, the lowest of low doses, to see how it goes. So it's really hard right now to make any recommendations with dogs with other underlying diseases, because we just don't know fully.
Okay, thank you.
I have another question. At what level did you see an increase in liver enzymes?
That is a good question. So we, in our pilot study, when we were giving 2.5 mg per kg, so about 1 mg per pound twice a day, we did see it in some dogs, but not all. And again, while we're blinded in this study, obviously we do see these results come in, and I can say some dogs have gotten through the entire study at, about 2 mg per pound twice a day, and we don't see any kind of increase. And then some dogs, it's painfully clear when they're most likely on CBD. Of course, we can't say that with certainty, but so a big part of that, I think, has to do with every dog, their endocannabinoid system is a little different. So every single dog, every single human, every mammal, they're processing these drugs very differently. And we know that about drugs in general. And so that's one reason why we say, start low, go slow with those increases, because it may be that your dog is hypersensitive and has a very low, tolerance, so to speak. or it may be a very high tolerance dog that, we're not seeing those liver enzyme increases and we need to give a very high dose to be effective.
Would you recommend then testing the dog's liver enzyme values at like every 6 months or every year or every 3 months?
Absolutely. Yes. We would recommend to do CBD to test 4 weeks later, so comparable to if you are going to start them on phenobarbital. If they're normal at that time, you can go ahead and do every 6 months unless you start seeing some clinical concerns, but at least every 6 months for sure.
Great, thank you very much. Any other questions out there? Anybody? Becky, I'll turn it back over to you.
Okay, so I do have one quick question before we go. I was out in Arizona and had never experienced CBD for my dog before, and went to a shop and I said my dog was anxious sometimes, especially when he goes to dog shows. And I talked to them about that. And so they recommended that I give him some CBD before we went to the dog show. And we were participating in obedience. And so the first time that I went with him, I had given him the CBD just before we left the house. And when we got to the dog show, he was very calm and he was amazing in the ring. Like, he was so attentive. I'd never seen him like that before in his life. And he was great. And then the next time I took him, it was a longer time between the time that I gave him the CBD and we went in the ring, and he wasn't quite as good. And then the last time we went, it was quite a long time between the time that he took the CBD and we went, and he was normal. Let's put it that way. So I concluded from that, giving it to him shortly before he went in the ring was more effective. But is that like just odd, or that he didn't have any tolerance for CBD before, or, and I also wondered about whether he should take CBD on a low level all the time and then take a little bit more when he's going to go have some exciting event. Any comments on that?
Well, yeah. So like Brianna had said before, each dog is different with their tolerance. So it sounds like he has maybe like he shows signs immediately, and then maybe just giving the longer period, obviously the levels are, cleared out of his system pretty soon. So I think what we had talked about earlier was that, yes, maybe giving more of a maintenance dose would be helpful. And then you also try giving that higher dose right before the events, or a couple of hours before the events. How long, the first time did you say you gave it to him?
It was maybe like an hour and a half before the show.
Okay.
And then the next time we had a longer wait before we were going to go in the ring. And so we always took it at home before we went to the show. So the next time it was like maybe 2.5. The last time it was more like 4 hours.
Okay. Yeah, because we had mentioned before that we think around 2 to 3 hours we can see that peak level within the blood, and so maybe that was it. But do you have any other comment?
No, I mean, I think that's it exactly. Like we said, normally we see kind of between 2 and 3 hours, but that was one cohort of dogs, and that was the average. So I think in a way you kind of did your own pharmacokinetic study, so you found that perhaps, that level is peaking around an hour and a half and then just gets excreted from the system faster. And that's one thing that's, kind of exciting about CBD, also frustrating, is that we are still playing with it and experimenting quite a bit. If, he has some general anxiety, doing that maintenance dose could be really helpful. And then, as Dr. MacQuiddy suggested, doing a higher dose, ideally an hour and a half or so ahead of time. However, if he's very normal and happy at home, certainly just doing the single dose, it sounds like worked really well. So sometimes, you know, you just have to find something that works and go with the old adage, if it ain't broke, don't fix it. So.
Right. Okay. Thank you.
In our experience with it, you find like there's a magic window where like 45 minutes is perfect, but an hour and a half is too long and a half hour is not long enough. But I think each dog has their own little window where it's most effective, and like you find
And the
them.
strength matters too.
Definitely.
Strength and dosage certainly, but you do find, you know, we use it for doing nails. And
on our
honestly,
Otterhound.
if it's in, you know, you got a 80, 90 pound dog that you're trying to hold while you do its nails, it doesn't work. You got to calm them down somehow, and CBD works. And it's just finding the strength, the dosage, and the timing matters a lot.
Mhm. Yeah, we like give Ellie like maybe 5 drops of a 750
Milligram or whatever
strength.
it is, yeah.
And then we do everybody else's nails, and that's about 45 minutes. And then Ellie's perfectly ready and
Yep.
says, "Here's my paw." If we have a slowdown or we stop and it's an hour and a half, she's like, "Yeah, maybe not so much." If we forget to give it to her right away and we try like in 50 minutes, it's no, not so much. But she's got that magic window of like 45 minutes to an hour where she is just like.
Same with showing. It works with showing too, for sure.
And
You
I'd say-
gotta calm her down a little bit.
And I'd
You
say
gotta
the
time
window
it.
is a lot longer for showing than
Yeah.
nails, but you definitely develop your own little
Yep.
routine and dosage.
Yeah.
And we had a dog that we tried giving her a couple drops for arthritis just to see if it would help her, and she got really wobbly.
Yeah.
So it took 3 drops, and we realized, okay, not for
She
that
doesn't
one.
need it. Yep.
Yeah.
Now, we've experimented with it a lot on our own,
On our dogs.
on our dogs. So for a variety of different issues, and
For
it
seizures.
works for some and it doesn't work
Yeah.
for others, and
Yeah.
you just got to find the right one. I'm a big supporter of CBD,
Yeah, we use
but you got to find out what you need it for.
and we use it daily on dogs that have seizures, and it has helped a lot. And they are not on medication, but it if we stop the CBD, then they tend to have seizures, not Otterhounds, and they're
And
not
it's-
bad seizures.
And it's seizures that are like every
3 months.
8 to 16 weeks. And it seems to really help those, and it helps them, if they have one, to recover from it. If you pick up on the warning signs of a seizure and give them CBD, it'll either stop the seizure or it'll be much milder, and they'll recover from it much quicker.
And that's in our experience
Yep.
with our mild seizures that
Yeah,
are.
we aren't like experiencing multiple ones a week or anything like that. It's just the occasional seizure.
Right.
But
And we are not vets.
big seizures, not
Grandma, yeah.
yeah.
Yeah, that's amazing. I mean, that's definitely a potential future study.
Yeah, I'm a proponent of it, and I thank you for your work.
Yeah, and it has been amazing. We have had amazing results with it. We've used it now for 3
different dogs.
3 years.
Yeah, and on 3 different dogs for different reasons, but it's
Yeah, we've had really good results. And we had to experiment a little bit with the dosage and the timing and stuff like
And
that.
we have done our own research on it. My wife, especially, Robin, has done a lot of research, and you figure out what you need to do. But it'll be nice,
The
to
more
see
the more
what
studies that are done,
clinical trials
Yeah.
find.
it's definitely going to be beneficial, and we're very excited about
Yeah.
your research.
We are as well.
Carmen has a question.
Hi, I was just curious. You spoke earlier about the metabolism and cannabinoids being produced in a low baseline in the body and all that stuff. I was wondering if there was any sort of link or something within your study that took into account age in if a dog is older and needed more of a dose, or the high metabolism of younger dogs, or something to that effect, whether or not you would see more adverse effects like the stiffening or the wibbly wobblies in one age group or another.
To my knowledge, I don't think we've taken age into account. I think that the age range, for the most part, they are on the younger side. But I mean, the only qualification for being enrolled was that they had to have confirmed idiopathic epilepsy. So if they had it confirmed when they were 2 years of age and they're now like 8, then technically they can still be enrolled. But I don't know the specific age ranges of the pilot study.
Yeah, and with the pilot study, it was very small. That was kind of one of the limiting factors. So we weren't able to really make those kinds of correlations. With our current study having 61 dogs, we certainly are hoping that we can look at some of those questions a little bit better. But as Dr. MacQuiddy mentioned, I mean, most dogs with idiopathic epilepsy tend to present pretty young. And so, you know, we do tend to have dogs kind of between like 2 and 5 years old. It's not as common to get an older dog in the study, so that might still be kind of a challenging thing to really look at in this study, but it's definitely a very good question and something to keep in mind.
Cool. I just had one more follow-up question. Based on your study design, did you see, I mean, obviously double-blind studies are meant to remove bias as much as possible. Did you see any form of, or like, how did you take into account for like environmental bias? So, you know, instead of it being randomized, the dog would go into like the vets or something and that would have a seizure. I mean, was there any way to keep track of that? And like knowing seizures, you know, come and go and you can't really pinpoint it.
Yeah, so for the most part, if they had any sort of, you know, onset of a cluster seizure or they were in status or something, and maybe because a lot of the people actually don't live very nearby, maybe coming from a couple hours away, and so they need to get somewhere sooner. And so if they would go into the emergency vet, for the most part, people were pretty good about reaching out and saying, what should I do? Like, obviously, so for the current study, we're not the main goal of the study is to evaluate CBD when they're already on anti-epileptics and not changing their prior medications. And so that's hard with dogs that are having, you know, 2-3 seizures a month, you know, even 2 to 3 in a day, or we have a dog right now that's having hour-long seizures that we're trying to, you know, figure out if she's going to be able to stay in the study or not, or if we're going to need to change her medications, which would ultimately disqualify her. And so we still do, you know, follow up with their care if they're not seen by us. So there have been instances where dogs unfortunately had to, you know, be taken out of the trial because we just needed to adjust those medications. And we want what is best for the animal. We by no means want to cause any harm to come to the animal. And so if it's deemed necessary, if we've done all we can do, but the dog still needs those adjustments, then we make those adjustments, and we just can't use their information or those results in our study, but because the main goal is to make sure that the animal is taken care of and does well. So we do a lot of follow-ups, people emailing us either in the middle of the night or, you know, during the day on the weekends, and so we coordinate with the emergency vet or their primary care veterinarian. And so sometimes they have their own neurologist in their area that they normally deal with. For the most part, most of them just are managed by their primary care veterinarians. And so we do have that collaboration with them as well to kind of find out what the best plan going forward is for their animal.
So I have another question, if you don't mind. When you were qualifying dogs for the study, and I recognize that you weren't part of the original study, did you bring in within the group purebred dogs that had a genetic propensity for epilepsy, mixed breed dogs, and or did you have any Otterhounds in your study?
Well, no, I don't think we had any Otterhounds. I don't think I've actually ever met an Otterhound, to be honest.
Yeah.
I had to look up what the breed looked like. So yeah, that was definitely interesting to find out. But no, unfortunately, no Otterhounds. Again, because of the pilot study's size, we kind of just took whatever dogs we could get enrolled in the study. Obviously, there were, a number of, mixed breeds versus purebreds, but we didn't specifically look for, Shiba Inus or a specific breed to be enrolled. But if they happen to, pass us by and they reached out and said, I'm interested in being enrolled, then certainly we didn't, we enrolled them. But unfortunately, because of the size of the study, again, we couldn't really account for purebreds versus mixed breeds.
Okay, well, I really appreciate you both joining us tonight. And I think we've all learned a lot. It sounded like you guys would be willing to let people send you emails occasionally if they have questions about the use of CBD with their dogs. And we hope that we can keep in touch with you and see how your research progresses, and we wish you well. And so thank you so much for joining us, and we'll say good night.
Yeah, thank you so much for having us both. Like you said, any questions about anything regarding CBD or our studies, you can definitely reach out and look for some results next year for this current study.
Well, we'll be excited to get that information, and we'll look forward to touching base again.
Thank you both very much. I really appreciate it. One other question that came up was, would we be able to access your PowerPoint in some fashion, either by having it linked to the YouTube recording or some other fashion?
Sure, I can definitely get that sent out to you guys.
That would be great. And thank you everybody who participated and came tonight. I'm really glad that you signed up. I'll be sending you a thanks for coming email with a link to the YouTube video, and feel free to share that with others as you wish. And thanks for coming.
Thank you all.
Thank you.
Good night, everyone.
Thanks, everybody.
Thanks, Becky.
Good night.
Good night.
Thank you.
Thank you, Joey.
That was really good.